Welcome back to San Antonio Living this morning. We're chatting with Dr. Elizabeth Glazier with WOAI-med. And if you know, WOAI-med is here in San Antonio. They do a lot of great services for everybody here in town, but especially some of our elders. And it's good to see you because I know this morning we're talking about something that a lot of people have questions about, palliative care. And that's a big word for me. What does that even mean? How much does that encompass?
It's a big word, and it really encompasses a medical subset of care for patients dealing with life-limiting chronic illnesses. It's usually performed by doctors who have a subspecialty in palliative care.
Okay.
It's a multidisciplinary team, so often the doctor, a nurse, a social worker, a chaplain, perhaps a pharmacist, a psychologist. And really the goals of palliative care are to work with your primary care physician in order to improve the quality of life for the patient and the caregivers who are really dealing with the challenges of serious chronic illnesses.
You know, when you're with a loved one in the hospital or dealing with an illness, you hear things like palliative care and you're like, what is that? I don't even know. And so that's why we're talking about this morning. Is it like hospice or different?
Great question. So palliative care, there are two main differences between palliative care and hospice. Palliative care can be offered at any age, any stage of disease, whereas hospice care is often held up into the last 6 months of an illness. So two physicians need to say that a patient has less than 6 months to live to be eligible for hospice care. Palliative care, however, we'd love to be involved right at the outset of the disease. So if you get diagnosed with a malignancy or congestive heart failure, it would be great for you to see the oncologist, to see your cardiologist, and to also have a palliative care physician.
Okay.
The other big difference is that for hospice care, you have to really forgo any curative treatments. So you have to say, you know what, I don't want that chemotherapy, I don't want the radiation treatment anymore. Whereas palliative care, we encourage people to continue the curative therapies if that's their goals.
Okay.
And it's really important for both palliative care and hospice to, focus on, again, the whole body care. So head to toe, whether it's physical pain, spiritual pain, psychological pain, emotional pain. Really, that's what a palliative care physician would offer you.
So you're looking for one physician that specializes in palliative care. Otherwise, it would seem like you'd be all over the place looking for different physicians everywhere.
Well, the palliative care physician usually works in cohort with your primary care physician or your oncologist or your cardiologist. So you still are seeing your other physicians. It's just, again, an extra layer of support. Okay.
Is this something that most insurance companies would cover?
Yes, for sure. It's a consultant pay. Certainly at WOAI-med, we have a great program. We have a home visiting palliative care program where we visit patients who are ill enough that they're unable to get to the office to see the provider, and so we actually bring the clinic to the patient, so kind of bringing that black bag back. And now it's very high tech. It's not like the old days where you just carry your stethoscope and your blood pressure cuff. Now we can get x-rays in the home and EKGs and joint injections and lab draws. And so it's really a nice way for the patients to be comfortable in their home, and it's a great way for me as the provider to introduce myself to the family and see the entire family dynamics and see who's there to support the patient and everything.
So this could be for someone as young as 10 years old who's dealing with a leukemia diagnosis on up to someone who's 60 years old who's dealing with a heart diagnosis.
Exactly. Or a 90-year-old who's dealing with dementia. And often at that point, you're really helping the caregivers more than you are the patient.
As a caregiver, what kind of questions would you ask to your palliative physician to kind of make sure that you're asking the right questions?
That's a great question. I mean, one of the really important things to first talk about with your loved one is what are your wishes? What are your goals of care? And that's going to be a huge focus for the palliative care physician to talk about with the loved one and the caregiver.
Okay.
We want to make sure we respect those goals and those wishes. And then you also want to make sure that any symptoms, any suffering that you might be having doesn't go unnoticed.
Okay.
Obviously, a physician is great. One of the biggest questions you'll get asked when you first enter the doctor is how much pain are you in, from 0 to 10. But no one asks you, are you sleeping? Are you depressed? Are you anxious? Are you dealing with losing your functional decline because you can't work because you have the life-limiting illness? So those types of things would be great for a caregiver to help bring out to the physician.
Okay, great information. Thank you so much for coming this morning and sharing that with us. I want to give you some more information about WOAI-med. They're started here in San Antonio, just an amazing medical group. And of course, they are a big part of Caregiver SOS. If you've got questions, check the website, caregiversos.org, or call the number on your screen. It's 871-7SOS. Again, 871-7SOS. Leslie?
Great information. Thank you, Shelley. Coming up, actor Jesse Borrego is in the studio. We're going to be talking about his new film, Mission Park, shot right here in San Antonio. That's next.